Hello, folks. Hope you all enjoyed the holiday season and are just getting back into a routine now. I'd like to wish you all the best for 2019. And I'd like to kick it off just with a brief video today about New Year's resolutions. I'm sure your inboxes have been completely inundated with new plans and proposals. So I'd like to start by just making a very simple suggestion of a daily habit that would help to improve your musculoskeletal health. Now, musculoskeletal health, which rather cumbersome terminology, is everything that deals with how the mechanics of your body functions, which of course is the area that we as physiotherapists spend all our time dealing with. So whether that's joint function, keeping your weight bearing joints functional, your hips, your knees, your spine, or whether it's your flexibility. In order to be able to move efficiently, you need to be able to move through different combinations and ranges of motion. So a lot of us, if we don't specifically work on movement patterns, we lose flexibility, particularly once we get into our 30s and 40s and beyond. And of course, preserving our muscle strength as well, which is another critical component for effective function. And some pretty damning statistics out there that we lose about 2% of our muscle mass every year after the age of 40. And if you just think about that for a minute, very few of us lose 2% of our body weight every year after the age of 40. So it gives you a little bit of an indication there as to how useful functional muscle transforms into less useful adipose or fatty tissue, which isn't always visible on the skin. It's deep within the muscle fibers. So unless you're specifically doing things to maintain your muscle strength, and that generally has to be some form of resistance work, whether it's using your body weight or using external weights or some sort of a resistance device, a band or a TRX, any amount of combinations of those things really, unless you're doing those things, your muscle strength will deteriorate. So you've got to work a little bit harder to keep on top of things. That's particularly if you're in the over 40s age bracket. Those on the younger end of the scale have a little bit more leeway, fortunately. So I would just pass this New Year's message on to you that in terms of maintaining your musculoskeletal health or trying to improve your musculoskeletal health, you need to think of it in a few different components. If you have joint related soreness, then that obviously is something that physiotherapy can help with. So at Dublin Physiotherapy, we deal a lot with people with joint issues. And even though there may be degenerative changes in the joints, very often you can improve their function with graded manual therapy or manipulation and stretching and varying combinations of techniques. So you can get the mechanics of the joints better. And that often helps people to achieve a better baseline function so they can go about doing activities that they want to do, whether that's casual tennis or kicking ball with the grandkids or playing golf or whatever the task may be. So that's a large proportion of folks that we see whose systems aren't allowing them to function, and it's a case of trying to identify why. Sometimes joints get sore because the muscle control isn't sufficient. So when we go through a systematic analysis of muscle strength, if there are deficits there, then it's very important that one works to a graded regime starting from where you're at now. That doesn't necessarily mean starting at the bottom. It just means starting from your current level of capacity. So that has to be evaluated by a battery of physical tests, which are straightforward to do. And then it's a case of gradually working through the progressions so that you can achieve the objectives that you want to do. So they're very typical kind of things that we would see in clinical practice. The other component, of course, is flexibility. And unless we specifically do things to try and preserve our flexibility, then we lose our range of movement. The tissues get less elastic, and therefore there's more resistance to movement. So movement is more awkward. It's easier to strain tissues when they're less elastic. It's more intense muscle work to try and move if you're naturally stiff. So generally, we want to try to have enough flexibility that is compatible with what we need to do with our daily living. And of course, many folks who are sedentary during a large proportion of the day, they lose flexibility through the lower spine, thorax, hips. Those tissues become relatively immobile. So it's about trying to identify where your deficits are and having a specific plan that may either be in a individual tailored program. So we would see a lot of patients who have a specific flexibility program or functional strengthening program or a home regime tailored to what they need to do. Or if they prefer to use a gym environment, then it's quite simple to prescribe the most specific exercise. And that's the key thing, the most specific exercise. You can spend a long time searching, and there are infinite amount of exercises. It's a case of, are they the most relevant and give you the most bang for your buck? So that's really where our expertise at Dublin Physiotherapy is. It's really honing in on where you'll get the most return for your efforts in the most efficient time scale possible. So that's really where I would say our expertise is. So whether you choose to do a home exercise program or work in a gym, or you're just looking at some general weight loss, obviously very topical at the beginning of the year after the excesses of the Christmas break, and again for weight loss, sometimes people try to jog when really maybe they don't have much of a history of jogging or have some underlying mechanical issues which get ruthlessly exposed with the impact of jogging. And it's not necessarily that jogging shouldn't be undertaken. It's just that if there are weak links in the system, an activity like that will expose it. So often one has to look at some intermediate measures. And again, body weight exercise can be a fantastic introduction to that. So that was the thought I'd just like to leave you with today, a fairly short video just about outlining what components are involved in trying to optimize your musculoskeletal health. And very often it's not a case of needing prolonged courses of treatment. It's just a case of getting a trained eye to zone in on where your deficits are, and then structuring your regimes that you can often do under your own guidance to correct those regimes, which then allow you to do the more general activities that you would choose to do. We'll follow again over the coming weeks and months into 2019 with hopefully what you find useful tips and information on all matters of musculoskeletal health. And so we hope to see you again in another video. Until then, bye for now.